Today I want to talk about weight, a commonly misunderstood topic. My aim is to help facilitate a more well-rounded perspective on the issue.
Well, I mean, fat people exist. There's no question about that.
And as a medical professional, when I talk about people who are overweight, I think three things are especially important. Number one, that I am objective about the risks involved and communicate those risks clearly and accurately. Number two, that I am empathetic about the challenges involved in taking steps to change your body weight. And number three, that I offer as much practical advice as possible to help everyone take their health into their own hands so that they can move freely and live pain-free. In March 2020, the CDC reported that the US obesity prevalence to be 41.9%, a number that has grown by a factor of approximately 10% since the year 2000. The health risks associated with obesity are well documented in scientific literature and include an increased incidence of cardiovascular disease, an increased incidence of metabolic disease, a higher incidence of some forms of cancer, an association with respiratory dysfunction and sleep-related disorders such as sleep apnea, and musculoskeletal problems and injuries, among others. The severity of these health risks has led to the term obesity epidemic and has prompted many healthcare professionals to join the conversation. Here is a clip from an interview fellow YouTuber Dr. Mike conducted with Dr. Salas, MD, PhD, a board-certified bariatric surgeon.
When your doctor talks to you about your weight, it's most times not because they're trying to attack you, but because they want to help you.
We'll see Mike and Argavan again later, but I agree with her sentiment. As medical professionals, it is not helpful for us to avoid or undermine the severity of the issue, though our patient may be insecure about it. But neither is it helpful to oversimplify the issue and denounce people who struggle with their weight. Here on YouTube, Michigan Medicine has a great video that will deepen our understanding.
Most people think that those of us who properly manage our energy balance remain lean, whereas those of us who eat too much and exercise too little become obese.
Many view obesity as a lifestyle choice. Maybe you've heard someone say, just exercise more, just eat less. But it's not nearly that simple.
Your brain has its own sense of how much body fat it should have on board.
Here, Michigan Medicine is referring to the set point theory that states that the human body tries to maintain its weight within a preferred range.
And it has a complex system in place that very precisely regulates your energy intake and expenditure. 2,
keep your body weight within that set point range. To this end, your brain interacts with hormones like leptin and ghrelin. Leptin is released by body fat, and the brain determines how much energy is available in the body at a given time by the amount of it that is circulating in the bloodstream. It then directs the central nervous system to adjust food intake and energy expenditure accordingly. Ghrelin, on the other hand, is famously known as the hunger hormone, released by the stomach when it's empty to signal to your brain that it's time to eat. You can imagine what would happen if either of these hormones were imbalanced. With these two examples, I hope to draw your attention to the complexity of the set point system that regulates our weight and influences how satiated a person may feel, how their body burns energy, and so on and so forth. This is a system that involves other organs and hormones, and in most cases that cannot be overpowered by willpower or a desire to lose weight. With leptin and ghrelin, we've only just scratched the surface. The thing is, once your brain has established a new set point, well...
Amanda's brain doesn't know that she needs to lose weight. It only knows to defend her current set point,
mobilizing all the available resources and systems to do so. And thus we see around a 95% failure rate when attempting to treat obesity with diet and exercise. In almost every case, it doesn't work. Those are very sobering results.
One thing we know about losing weight with diet and exercise, only about 5% of people who lose weight that way are able to maintain that weight loss.
And so modern medicine has developed other procedures, such as bariatric surgery to assist people struggling with their weight. In the past, some eligible patients have shied away from this treatment, believing it to be dangerous. But with the advancement of modern medicine, the odds have improved.
The risk to dying within 30 days of surgery is less than it is for having your gallbladder taken out.
There are several types of bariatric surgery, including the gastric bypass switch, sleeve gastrectomy, and the biliopancreatic diversion with duodenal switch. Each of these procedures reduces the size of the stomach to reduce the amount of food you can consume. And the biliopancreatic diversion also bypasses a portion of the small intestine to reduce the absorption of nutrients.
We don't 100% know in terms of the weight loss why it's more effective. We think that it helps reset people's kind of set point.
Which makes sense intuitively. Surgically, we're putting a hard limiter on food intake and nutrient absorption. Oddly enough, there are also people who have undergone a bariatric procedure who still have difficulty losing weight. A study from the Journal of Bariatric Surgical Practice tells us failure after bariatric surgery is defined as achieving or maintaining less than 50% of excess weight loss over 18 to 24 months, or a body mass index, BMI, of greater than 35. The failure rate of laparoscopic Roux-en-Y gastric bypass has been reported to be 15%, with a long-term failure rate of 20 to 35% and a revision rate of 4.5%. These stats are puzzling and allude to the multifaceted nature of the weight gain epidemic. I repeat, even when you limit the most obvious variable, some people still have difficulty.
1, 2, 3.
In his video reacting to clips from my 800-pound life, Dr. Mike points out just how difficult it is to live with this much weight. Simple things become both difficult and very important. Here he speaks to what can happen if an obese person does not reposition their body often enough.
You start putting pressure on certain areas of your skin, your muscles, your bones. You could develop pressure ulcers. Those can get infected.
In my own clinical practice, I have operated on obese patients, and I am struck by the amount of assistance they need to perform basic tasks. When you've seen firsthand how difficult living, moving, personal hygiene becomes, you are much less likely to pass obesity off as a choice. Other studies have shown a positive association between adverse life experiences, aka trauma, emotional, physical, and sexual, and adult obesity. There is also a high comorbidity between obesity and binge eating disorder. One hypothesis is that in at least some cases, there are underlying emotional factors that may be leading someone to behavior that results in obesity. When we open our mind to consideration to the forces acting upon overweight individuals, we are forced to consider other things as well.
Changes to the chemical and nutrient content of our food, the so-called Western diet, a decrease in physical activity, increased levels of stress,
and the list doesn't stop there.
Inadequate and disrupted sleep, and more widespread use of medications that promote weight gain all play a role.
All of the things listed here are associated with weight. Are you beginning to see the bigger picture?
Do you understand now?
I have seen people struggle with their weight and face severe health complications, and not for the lack of wanting to change. What is there to do when something feels like it's beyond your control? Perhaps accept it. Embrace it even. The accuracy of these images and others like them depends on our definition of the word health. Yes, at the clinical level, obesity is correlated with adverse health markers. We already know that. From a more holistic perspective, is it possible that learning to accept and smile through situations you cannot control could be associated with positive health outcomes, like, for instance, reducing stress and inflammation? Is it possible that a body image reflective of approximately 40% of Americans being presented on a magazine cover could help many people at home feel more comfortable in their skin, lowering general anxiety? Or
it's whether we should be celebrating a body image which is medically defined as highly dangerous. And I'll explain why.
I've heard that irresponsibility argument many times. But how do we measure scientifically the risk of this type of visibility or the effect it has on the overall prevalence of obesity? This is a difficult metric to quantify, as we've already seen.
So you can think of obesity as a biological response to the modern environment,
where
the body dysregulates to a body fat set point that is too high.
How someone responds to these environmental factors has to do with many factors: their genetics, socioeconomic status, social support system, and so on. With this in mind,
is it right to put people like yourself into a pop video celebrating that kind of weight? And I ask you honestly,
I cannot comfortably say. To say that it's categorically wrong implies that it will increase the prevalence of obesity in the future. As a clinician, I would need to see hard data to corroborate that claim. And even if this could be demonstrated with sufficient scientific evidence, it would draw our attention to the troubling fact that people actually draw conclusions about their health from the cover of a freaking magazine. Newsflash, you shouldn't take anything that you see on a magazine cover at face value, or anything you read therein as health advice. My goal is to encourage a proactive approach to health and wellness, where the average person takes advantage of the information available to them and draws their own conclusions about how to improve their health. The secret is, that's how to make lasting changes, by taking full responsibility for your health. Wait a minute, didn't I just finish saying that obesity is no one's fault? And now I'm saying that it's your responsibility to change it? Correct.
How, Sway?
This is sobering and frightening. But the reality is no one cares about your health as much as you care about your health. And any meaningful changes require a shift in overall lifestyle, which is the accumulation of small actions performed on a day-to-day basis. And most of the time, you're the only person there to choose what action to take. What does Argavon have to say about detractors from the "this is healthy" cover stories?
Trying to say that people of all different sizes can move, can be physically active, can love their bodies.
We live in a society where there is discrimination against people who look different. People who are overweight do get discriminated against. And so,
Body positivity movement should be about fighting this discrimination, not about saying that the diagnosis of obesity is a false one.
right. And Argavon sums it up very beautifully.
It's like a yes and. Yes, you should feel good about your body. And there are negative health consequences for obesity.
If these cover images help to get people up and moving, one could argue that they have a net positive value on general societal health. Ultimately, an active lifestyle and the confidence that you can have an active lifestyle, even if you are living in a body that is overweight, is a very important thing. The funny thing, in the most exact sense, actual size is only part of the problem, and not all fat is created equal. Have you ever heard of the acronym TOFFI? Thanks, Wikipedia. That's thin on the outside, fat on the inside. An acronym that refers to a person with excess internal fat content. This is called perivisceral fat, and it exists in the peritoneum, which is a membrane of smooth tissue that lines the abdominal cavity, like a bag for your organs. This is different from subcutaneous fat, which sits beneath the skin.
We need this as it helps to store energy, protects your muscles and bones from impact, insulates your body, helps with the transport of vitamins.
Thanks for the clip, Lucy Wyndham Reed. But see, visceral fat is more difficult to spot, hidden amongst the intestines, liver, and other abdominal organs. A patient may appear well normal from the outside, but the excess visceral fat that they carry has been associated with elevated risk factors, as you guessed it, obesity. What's more, it turns out the BMI is not a reliable indicator of perivisceral fat. The mathematical equation is outdated and doesn't take all aspects of the measured body into account. Doctorpedia directs us to an interesting study profiling sumo wrestlers who, despite BMIs well over 50, have far more fat-free mass, FFM, in and around their organs than untrained college students. A measurement system wherein a bodybuilder with 3% body fat can have a higher BMI than a 180-pound college student who never gets off the couch is surely flawed. Coincidentally, the best way to reduce perivisceral fat, get active, introduce whole foods, you know, the same things that help with obesity. It's almost as if our bodies are telling us to get up and move. It's because they are. And that goes for everyone. So if we know that an active lifestyle is essential no matter who you are, the question becomes, where do we begin? Well, with something you love to do. It's much easier to move when you truly enjoy what you're doing. It's advantageous to get the ball rolling from a place of genuine interest and expand your movement practice as you go. The more intimately you know the risks of obesity, visceral fat, and general inactivity, the more resolve you will have when you make your decision to change your life. Get to know the truth. When you feel stuck, reach out for professional guidance if financially viable. Trainers, nutritionists, medical professionals. Keep in mind, there are many cost-effective professionals offering free info right here on YouTube. Take my gym, Human 2.0 Fitness, for example. And please recognize that finding professional help is best viewed as a process, and you may not love the first gym you walk into. If you can find a community or start to build one with people who are committed to changing their life for the better, you will feel motivated to continue. And if you're someone who is lucky enough to enjoy an active lifestyle and a pain-free body, how can you support others in doing the same? We must first acknowledge that losing a large amount of weight is a daunting task. I'll tell you one thing. It probably won't help to point fingers at people whose body doesn't fit into a specific weight class. And if you've been taking any health advice from magazine covers, stop. I hope you've enjoyed the video. If you liked it, be sure to subscribe. And if you didn't, be sure to let me know why in the comment section down below. And as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.